Today, we're going to pull back the curtain on one of the most important conversations you can ever have, the one with your doctor. We're going to explore the hidden structure, the unseen blueprint that turns a simple chat into an incredibly powerful tool for getting you well. So, let me ask you this. Have you ever walked out of a doctor's office and had that sinking feeling that the one thing you were really worried about, the real reason you went in, never even came up? It's a common feeling, and believe me, there's a reason for it. And that reason is perfectly captured by this quote from physician David Pendleton. He said, "The consultation is the central act of medicine. It's not just a chat, it's a highly skilled performance, and when it's done right, wow, it can change everything." So let's actually take a moment to understand it. First things first, we really have to appreciate just how complex this conversation is. It is so much more than a simple question and answer session. I mean, think about all the pressure in that little room. You've got what, maybe 10 or 15 minutes tops. You're trying to explain something complex, and you've probably got these unspoken fears swirling in your head, like, is this serious? Meanwhile, the doctor has their own agenda, a clinical checklist they have to run through, while you have your agenda. It's a really high-stakes conversation, and it's all happening against the clock. So how do good doctors navigate this conversational minefield? Well, they don't just wing it. The best ones use what you could call a secret playbook, a set of frameworks we call consultation models. Now, a consultation model isn't some rigid step-by-step script. It's much better to think of it like a GPS for the conversation. It's a flexible guide that helps the doctor remember where they are, figure out where to go next, and really importantly, how to get back on track if things get sidetracked. It brings a little bit of structure to what can be a very chaotic 10 minutes. And these playbooks have been evolving for decades. Way back in the 50s, the idea of the doctor as a drug put the focus on the actual doctor-patient relationship. Then, by the 70s, models were pushing doctors to look beyond just biology and consider a patient's psychological and social world. But the real game changer came in '84, when Pendleton introduced a whole new framework. And finally, in 1996, the Calgary-Cambridge Guide gave us the comprehensive model that's taught almost everywhere today. It's been a long journey toward really, truly listening to the patient. So what's actually in this modern patient-centered playbook? Well, let's break down 3 of the most powerful tools a doctor has at their disposal. Okay, first step is that game changer I just mentioned, ICE. It's a simple acronym that stands for your ideas, your concerns, and your expectations. A great doctor knows that the medical facts are only half the story. The other half is what's going on inside your head. So what does this actually sound like? Well, to get to your ideas, they might ask something like, how do you have any thoughts yourself about what might be going on? To get to your concerns, they'll ask, what is your main fear or worry about this? And for your expectations, what were you hoping we could do for you today? See? These simple, open questions unlock the real reason you're sitting there. The next tool is called safety netting. Medicine is filled with uncertainty. So instead of just saying, let's see how it goes, a good consultation ends with a really clear what-if plan. What specific symptoms should you watch out for? When exactly should you come back if things aren't getting better? It turns uncertainty into a shared, manageable plan. And the third essential tool is shared decision-making. This is a huge shift away from the old model of the doctor just telling you what to do. Instead, it's about creating a partnership. The doctor lays out the options, and you discuss them together to figure out the best path forward for you and your life. Your voice becomes a critical part of the plan. And really, all of these tools, ICE, safety netting, shared decisions, they're all built on this one foundational idea, the biopsychosocial model. It's this understanding that a doctor isn't just treating a symptom, they're treating a whole person, whose health is this complex mix of biology, their psychological state, like their worries and beliefs, and their social situation. All right, so theory is one thing, but what does this actually look like in the real world? Let's see how this blueprint can totally transform a consultation. Just look at this contrast. On the left, you've got the old-school doctor-centered way, a series of rapid-fire closed questions, the doctor's just ticking boxes. But on the right, the patient-centered doctor starts with just one open question. What's brought you in today? And boom, instantly the patient shares not just the symptom, but their deepest concern, the fear of a heart attack, tied to family history. The real issue is on the table in seconds. And that's the absolute key takeaway here. This patient-centered approach, the one guided by these models, isn't just nicer to experience. It's actually more efficient, and it's a heck of a lot safer. It gets to the heart of the matter, literally in this case, in a fraction of the time. Now, here's the thing. Knowing all of this isn't just for doctors. It's for you. This knowledge can fundamentally change your role when you're the one in that room. When you understand this blueprint, you're not just a passive passenger anymore. You can become an active partner in your own care. You can start to think about what information is most helpful and make sure your whole story, your ideas, your concerns, and your expectations actually gets heard. So I'll just leave you with this to think about. Armed with this insight, the next time you're in that consulting room, you don't have to wait to be asked. How will you share your ice and help your doctor co-create the perfect consultation for you?